Welcome to Your Transformations, and we're honored to be sitting today with Dr. Douglas Brooks, the founding physician of Men's Health of Parkersburg. Dr. Brooks has been providing proactive and compassionate care to men for a number of years and has made a tremendous difference in many people's lives. Welcome, Dr. Brooks.
Thank you very much for having me, Richard. I appreciate that.
Yes, sir. Let's start with first, what inspired you, motivated you to start this type of practice, and kind of explain a little bit about it too, versus a conventional network office?
Yeah, so I've done corporate medicine on several occasions in my life. I did it in Florida. That was my first go, and then in North Carolina was my second go, and then most recently even here in Parkersburg, West Virginia. And I just discovered that I couldn't offer the best, what I felt to be the best care to my patients in a corporate model, where you're only allotted so much time to be able to spend with your patients. In addition, I've often said that children have pediatricians to go see and women have obstetricians, but men never really have had their own kind of physician that they feel comfortable establishing a relationship with. So with all that, I decided to open what's called a concierge practice, or another term for it is direct primary care, where you kind of take out all the middlemen and it's just you and the patient. And so my model here at Men's Health of Parkersburg is for men only. So we only have men in the practice. We do not see women or children any longer. And also, I can consider there to be three tiers to concierge, or what sets concierge medicine apart from corporate medicine, which is we give hour-long visit slots to all patients, because I truly believe that you just can't cover enough in 5, 10, 15 minutes. Those are what corporate medicine slots are usually put at, and so you just can't cover enough from a history and a physical and a planning stage in those 15 minutes. And in fact, there are studies that show there's a direct correlation between the amount of time you spend with your doctor and your survival rate, the longer you live. So 15 minutes versus an hour, you're going to live longer if your doctor offers you more time per visit. The studies have proven that. So here at Men's Health, we give hour-long visits to every patient. The second thing that makes concierge different is that we offer same-day availability. I know that most people in corporate practices have discovered that it may take days to weeks to be able to get into their physician, because those practices are so full that there's no schedule availability. With a concierge practice, we keep our numbers lower so that we always have same-day availability available to patients to come in when they need to come in. I think that's important for good health, preventative health, good patient satisfaction, all that. So that's the second tier. And then the third thing that I think separates concierge in my practice from other practices is that patients get my cell phone for evenings and weekends. They can text me if they're out of town. Let's say they're on vacation and they get sick or hurt. Then they can text me or call me on an evening or a weekend, and I will find the pharmacy where they are, and we will be able to help them out in that regard. So those to me are the three biggest things, and those are what we think sets us apart, is longer visits, same-day availability, and then what we call direct access to the physician, which means that they have my cell phone to be able to get in contact with me.
Okay, thank you. I know it will be important to me to feel like I'm actually being seen and heard and understood, and I have more time to understand the doctor. But from your own anecdotal background, what are some examples of that goes along with your stats you do, so where being able to take that time back and forth in the conversation actually had real life positive impact on patients, viewers.
Yeah, so again, to be able to accomplish an entire history and a nice head-to-toe physical and in planning stages of, what labs you're going to order, all the health maintenance issues that you want to review, again, simply cannot be accomplished in 5 to 15 minutes. So you have to have longer visits. And I kind of follow, I follow there are some literature and guidelines on what men of all age groups need to have done. And so every visit with a man, no matter what age group, because we take patients, probably our starting age is around 15 to 16, and then we do carry it on all the way to complete geriatric populations. So at every age there are different issues and different recommendations on health maintenance and that kind of thing. As you and I were speaking earlier, the three can be early killers of men that I really look out for are prostate cancer, colon cancer, and early heart attacks. Prostate cancer, the current guidelines are to check a PSA level in men, a Caucasian men at age 50 and African American men at age 45. However, I just had my most recent patient diagnosed with prostate cancer at age 43, and he was Caucasian. So now I start all my prostate cancer screenings with PSAs at age 40, which again is 2 years sooner than some of the literature recommendations. But again, if I waited to check his at 50, we would have missed 7 years, and he likely wouldn't have been alive. The second one is colon cancer, and they have recently dropped the recommendation for colon cancer screening from age 50 to 45. And we're not sure why colon cancers and prostate cancers are happening early in life, but it can be due probably to diets and environment chemicals and other things. So we are seeing colon cancer in men as early as 45. So now colonoscopy is recommended, or Cologuard, which Cologuard is the 3-year home test, whereas colonoscopy is an outpatient procedure that's, if everything's normal, is good for 10 years screening. And then the final thing that I've really looked into is early heart attacks, or what we call premature coronary artery disease in men. I really got interested in that because my own family, both my mother and father, were diagnosed with early heart disease in their lifetime. And so that became an interest of mine. And what defines early heart disease is men that get heart disease in their 50s or women that get it in their 60s. That is then considered premature, which usually has a genetic component to it, which means it's probably passed down to, children, or it could be brothers, uncles, and other places. So there now has become an inexpensive test called the coronary calcium. It's basically a CAT scan that does not have dye involved. It probably takes 5 to 15 minutes, to where they try to measure the coronary or the calcium plaque buildup in your coronary arteries to see if you do have clogged arteries. It's a simpler and less expensive screening test than, say, a stress test where they lay you on a treadmill and inject dye, or even like a full catheterization, where they have to go through an arm or a leg to shoot dye and take pictures. I offer that to all my men because some people because here in town it only costs $99 at WV Medicine. They're offered a cash price at $99. So I offer it to all my men, regardless of family history, just because a lot of people want to know. But again, unless there's a family history of early heart disease, most of those that you order on people without that history are going to probably be normal, and it may not be necessary. But in anyone that has a family history of early heart disease, for my patients, I do recommend that they have the coronary calcium. And I said that we really looked at their lipid panel to make sure we keep their bad cholesterol, their LDL at very low levels, even under 100, closer to 50 to 70.
Let's talk about some of these a little more in depth. If you had a patient who was reticent about undergoing the colonoscopy, what would your message be to him via conversation?
Well, in the literature, they actually do say if someone is absolutely 100% against colonoscopy, Cologuard is a very good option. Cologuard in the literature is 93% accurate. That means that they're going to miss 7%, of cases. Sometimes you'll get either a false positives, meaning that the Cologuard will come back positive, even though you don't have cancer. And then you have to have a colonoscopy to prove that you don't have cancer. But sometimes the more worrisome is when they come back negative, and then that's a false negative when you have a negative Cologuard test, but you do have colon cancer. And so, like I said, that happens on average 7% of the time. Theoretically, colonoscopy is 100% accurate in the hands of a good gastroenterologist or surgeon or whoever's doing your colonoscopy, and if you have a good bowel prep. So in that case, they recommend colonoscopy every 10 years because polyps, which are found on colonoscopies, generally take about 10 years to develop into colon cancer. And so that's why they say that you should have a colonoscopy excuse me, every 10 years. And then if there are polyps, you remove the polyps, and then if there are polyps, they most of the time they do shorten the range from 3 to 5 years instead of 10 years for colonoscopies. But if you're completely clean, then they recommend 10 years. Whereas Cologuard looks more for blood and cancer DNA in the stool, and then that's a recommended test every 3 years. So people are reticent, like you said, to get colonoscopies, but what I tell them is first of all, I've had 3 in my lifetime, and it's really not a bad procedure. The day, before you do a bowel prep, and which is really not as bad as what people make it out to be. And then the day of your procedure, you go under a light twilight sedation. It may take 15 minutes. You're in and out in the morning. And to me, that's a very small price to pay. I always tell patients, don't bury your head in the sand when it comes to these things. Cancer does not differentiate. It does not discriminate. So you just don't want to miss something that is treatable, curable, and preventable. It's a very sad tragedy when a man gets diagnosed with colon cancer that could have been prevented by having a colonoscopy or Cologuard. And along the same lines, prostate cancer by having a PSA blood test by their doctor, or preventing an early heart attack by having a simple 5 to 15 minute coronary calcium scan. So in any of those conditions, the first thing here for me is getting them into the doctor, and that's why I've tried to make this office more conducive, compatible for men. For instance, as you've seen, we put ESPN on TVs, we have men's magazines, we have comfortable leather seating. We don't allow women and children. We do sometimes if wives want to come in, to discuss the care plan. But as far as we don't see women patients in this clinic. So we want men to feel comfortable, like they have a doctor that they can go and see and feel comfortable and want to go to the doctor, because the first step of getting a male healthy is to get them to the doctor. So we do believe we've created that aspect of it. And then the second thing is just like you said, I think the more time I can spend with a man, and if it's up to an hour visit, most of the visits on health, but we can talk about some sports, we can talk about some other things that make them feel comfortable and make them feel that I genuinely care, about the medical care that I want to give them. My ultimate goal is to make them live longer, healthier lives. So they're going to be around for their spouse, they're going to be around for their children, to walk their daughter down the aisle, to see, you know, their son, you know, do whatever they're going to do in life. So that's, I try to instill confidence in you know, our relationship, and then I also try to get them very motivated to look out for their health and do the goals, because again, it's a tragedy when someone becomes a statistic that could have been prevented.
Yeah, it sounds, as I follow along, if one of the best things a man can do for their own well-being is to come in and see a doctor, this kind of setting is very conducive for that. Backing up with like colon cancer, prostate cancer, strokes, heart attacks, you're going to give lifestyle advice to somebody on how to better increase their chances of never seeing those dreaded diseases. What advice would you give?
And so for, you know, cancer, especially prostate and colon cancer, smoking is, as you know, at the top of the list. And then for colon cancer, certainly increasing fiber in your diet has been shown to reduce your risk of colon cancer. For heart disease and early heart attacks, obviously you want to control risk factors there, which is everything from blood pressure. You know, you want your blood pressure down to the 120 and 70 range. You want to control your cholesterol. We stratify cholesterol levels based on risk factors, but I believe that for most of my patients, I try to shoot for the bad cholesterol, or the LDL under 100, and the HDL over 40. And you can try to achieve that with diet and exercise levels, weight loss, and, you know, that kind of thing, eating healthier. But sometimes, you know, it does take a medication like a statin to try to lower the cholesterol to a preventable level. Yeah, we've all been taught this. Try to exercise 30 minutes daily or 60 minutes every other day. Try to eat as healthy as you can from all the major food groups: lean wheats, fruits, vegetables, grains. There's a Mediterranean style diet that's out there.
There's the Atkins diet for heart healthy people, or for people that have heart disease, although I believe that almost all meats are removed from I'm sorry, it's not the Atkins diet. We might want to edit that part out later. It's the Dean Ornish diet, is the diet that is used for people that have had heart disease, but it's pretty much a strictly vegetarian diet, so it doesn't appeal to everybody. And you know, to me,
fish, salmon, lean chicken, with your fruits, vegetables, and grains is the perfect style diet. Drinking a lot of water, trying to get the best sleep habits that you can, sleep hygiene, if you have sleep apnea, treating that, because that can certainly have effects on the heart. But I think obviously smoking is also involved with heart disease and all the cancers, especially the top 2 cancers in men. So trying your best to quit smoking is definitely important in preventing those diseases.
Your transformations, we try to help empower people to realize that the tomorrow doesn't have to be defined by today. The hopefulness of things like neuroplasticity, to where we can actually change at our core level. What do you say to your patients who kind of give up because of genetic factors? Oh, my family had this, so I have it now, or I'm going to get it, so why does it even matter? How do you help motivate people who kind of give up because of things like genetics or diseases on the family line?
Yeah, well, just because there are, diseases genetically in your family doesn't mean that you're going to get them 100%. You are more likely to possibly get those, but when I talk about the 3 big early killers of men, prostate cancer, which is certainly is genetic. They certainly recommend checking early ages if there is a family history, especially in a primary relative like your father or your brother, of checking PSA levels, prostate cancer. And in fact, with this most recent case that I've had where a 43-year-old was diagnosed with prostate cancer, they actually are going to be genetic testing him because he has two sons that are not just now in their 20s, but they're going to do genetic testing to make sure that these kids, don't have the same fate, or at least as they move on, more in-depth testing, more in-depth counseling, even possible surgery. These kind of things can be done proactively. So anyone that says, I'm doing because I have a family history of prostate cancer, that's what I would offer there. Is I'm not necessarily going to get it, but we can test for it not only from a blood standpoint, but also from a genetic standpoint. Colon cancer is also the same. The recommendation is either age 45 or 10 years before a primary relative got colon cancer. So let's say your father or mother got colon cancer at 45, then you actually are recommended to start at 35. And so again, as long as you can motivate people to go and get the colonoscopies, they can prevent these diseases, and they may not have the polyps that are going to lead to colon cancer. But if they do, they can be removed. And so, there are methods and methodologies in place to try to cure or prevent, find and cure cancer if we find it. And then with early heart attack, same thing. It certainly is genetic when it happens earlier to people. It's passed down. And so what I recommend is the coronary calciums, and if those come back positive, then we'll really get aggressive with risk factor management, with blood pressure, cholesterol, diabetes, smoking. And if it's moderate, then I'll usually refer them to a cardiologist to go ahead and get stress tested, get an echocardiogram. Also, if they need a cath. I've actually had a couple of patients that I did a coronary calcium on, the $99 test, that the next day they were in an ambulance going to a research hospital to have open heart surgery. So, and so it can be a very cost-effective and inexpensive screen that can save lives. So I don't think you're doomed based on your genetics. I just think you have to be proactive, and you have to have the motivation. And the motivation should be, I want to live, and I want to live a longer life, if not for yourself, for your family and your wife and your children and everybody else.
Surprising to me is the impact that falls have on human beings regardless of age, from young to elderly. What advice would you give to people that they can take ownership with to improve their ability to not fall, and if they're starting to lose their balance, maybe regain it quicker and recover? What are your thoughts on falls and how perhaps epidemic they actually really are?
Yeah, I think as we get older, falls are they're more prevalent because first of all, we lose some proprioception, probably due to nerve function, brain function, our ability to be aware of environment changes in movement, that kind of thing. Also, we fall because eyesight, hearing aren't as good. Also, we fall because maybe, we have joint pain, we're favoring a joint, so we reciprocate, in the opposite direction, which puts our posture, our gait off, and that can lead to falling. So, with age, inevitably, I think what's going to happen, that I do think that, walking, especially as we get older, walking and doing daily stretches or every other day stretches, because what stretches do is twofold. When you're stretching, they make you maintain balance and work on your proprioception in different directions. They also make you more nimble and flexible, so that you have less pain and your posture and gait is probably also going to be more normal. So those are some of the bigger things that I recommend for people. For weight training, I think is still important, but a lot of times as we get older, we give up some of the weight training and the jogging and the running, and so just simple walking, 20, 30 minutes a day, or if you can't do it every day, maybe 60 minutes. And then maybe right after that, going into a 20 to 30 minute stretch program. And I actually have developed my own head to toe stretch program that I do myself and I've given to patients as well. And I think that helps is what we're saying with falls. And then obviously, like I was saying, keep, visual checks. Anybody over the age 40 should be seeing an eye doctor probably every year. Hearing definitely, I think, influences balance. And then finally, I have referred patients to physical therapists for gait training. There are clinics in town that specialize in vestibular, which is in the brain and the ears, which is involved in balance and proprioception again. But they also work on gait training, strengthening, flexibility, all that kind of stuff. So if I have a patient and that's one of their main complaints, then I'm probably going to move through that progression of plan for them.
How do you perceive wellness, the whole person concept of a human being? How would you say your concept of that has changed throughout from the beginning to present now in your career and your practice?
Oh, that's a great question. I've been in practice now. I've had my MD since 1997, and then I did residency, and then so I've been in private practice now for 25 years. I think early when you're first out of school and residency, you've learned about all these medications and things like that. So that's always staying in mind, and that's what I'm not that you push that on people, but a lot of times that's what's at the front of your mind when it comes to health and well-being, whether it be mental or physical health. But since then, over the years, especially over the last 10 to 15 years that I've really concentrated on men's health. I had a Seminole clinic in Charlotte, North Carolina, and then since I've been back to Parkersburg, even when I was corporate, I still focused, mainly on men. But now that this is our 4th year of having Men's Health at Parkersburg opened, I'm much more now into promoting natural, healthy lifestyles, holistic approaches without medications. I am not anti-medications by any means. I realize that they are important for physical health and even for mental health. Whether we talk about statins to lowering cholesterol, lowering heart disease and heart attacks, or if we talk about some medications for anxiety and depression. But I still believe that the best thing that you can do for physical and mental health is to try to exercise about every day, and it can just be as simple thing as walking. Also, stretching, developing a stretch program. It offers so much freedom physically and mentally when you stretch. And then most recently, I've gotten into the infrared sauna. I've researched it, some of the studies that are going on. I actually bought an infrared sauna for my house, so that after I do my walking program, stretching program, I typically get in my infrared sauna for 20 to 30 minutes. And I actually continue to do some exercises and massages even while I'm in the sauna. That has allowed me personally to reduce some of the medications that I was using for pain, especially the anti-inflammatories like the Motrins and the Aleve, and even some of the other medications that are out there, some of the vitamins and supplements I've been able to reduce. Although I am still a firm believer in certain vitamins. I think multivitamin is important. I do like vitamins B, C's, and D's. I like magnesium for people that are having some muscle pain. I'm a huge proponent of fish oil capsules. I believe that can help with joint pain, softening the cholesterol, maybe some brain health. Also probiotics. They've linked the gut so much to physical and mental health that to keep healthy flora of bacteria in the gut, and that's what probiotics does. I really believe helps the health. Obviously, the men's clinic, we focus on primary care, preventative medicine, and family medicine first, but being a men's doctor, I'm also very much in tune with, hormone therapy for men. I believe that it does have some health benefits. There are studies ongoing with hormone therapy for men that include everything from heart disease, blood pressure, cholesterol, depression, of course, libido, maybe some ties into Alzheimer's prevention. So until those studies are finalized, but I am a proponent to try to keep men's hormone levels up to a certain level through various means, obviously. And then, a lot of people are talking about peptides. That's one of the I don't want to call it craze, because it is real. It's there have been some doctors that have written books on peptides. There was a lot of literature. There's some, you can Google and read the research yourself. What's interesting is that they're not FDA approved, but neither are vitamins and supplements are not necessarily FDA approved either. And most of the peptides, they have to be labeled for research only because they're not, they're not for human consumption, or at least that's, what the whole legality issue of it is. But for some people, there are some peptides that are being studied currently, like BPC 157 with TV500. That is definitely, and you can read about it on WebMD, that has been shown to reduce pain in some individuals, especially arthritic pain or pain where tendons and ligaments hit the joints. So if someone has tried everything and they're still having pain, then I might suggest that they do their own personal research on peptides. Some of the other peptides that are out there, there's CJC1295 with ipamorelin, which is supposed to be a human growth hormone stimulant. Again, you can read about it on WebMD. There are doctors that have written about it. Obviously, again, it's not FDA approved, but people can do their own research and they can make their own decisions on if they think it could be a benefit to them. And then research companies that have peptides and pursue them if they want. So if someone asks me about peptides, that's what I'm going to tell them. I don't recommend peptides to any patient unless they personally ask me. And then I think that because not everything is one size fits all, but if it can be a tool for someone to get better, from whether it be a pain standpoint or a metabolism standpoint or possibly an anti-aging standpoint. The final one I was going to mention is NAD that's now out there being studied. Does it possibly help joints, skin, brain health, heart health, mood health? These are some of the studies that you can read about. So again, I don't recommend I don't recommend peptides first line. I guess is what I'm saying. But I do think that there's more to learn about them, and there are ongoing studies, and they can certainly be a tool in someone's overall health program. So back to your question on how I've kind of moved over 25 years, is I've gone definitely from traditional, Western type medicine to now more preventative, holistic, medicines, and possibly even some newer technologies and cutting edge things that are being studied.
I do want to close with this. You mentioned gut health, and I think more and more people are learning about this, but I think there's still a lot of people who aren't aware. So when it comes to dental health and hygiene and gut health, can you just share with everybody just a little bit of the impacts that both of those areas can have on your whole human body when you don't care for them?
So every patient that I see, I look at their dentition and I ask them if they go to a dentist regularly, because there are studies in the literature that show that dental health is definitely related to physical health. And what the theories are is that bacteria that are part of gingivitis and plaque at the gum line, they're swallowed, and then they hop from your gut into your bloodstream, and again, those are bad bacteria. So if those bad bacteria are creating inflammation in the joints, is that contributing to arthritis? If it's creating inflammation in the blood through the arteries of the heart, is that possibly increasing your risk of heart problems? If these bad bacteria are floating, in the bloodstream, also through, the brain, could that be contributing to cognitive decline? It's the same thing with the bacteria that live in the gut. We want good bacteria because, again, the bacteria could be in the bloodstream and creating the same problems of the bacteria that come from the teeth. And so, yogurt I would recommend yogurt over probiotics, but a lot of people don't like yogurt, so that's why probiotics is on one of my top supplements, because I do believe that the gut and the teeth are the two hidden pathways to having much better health. So I try to encourage people to take care of their teeth, seeing the dentist, flossing. I've had a lot of dental friends over the years that have told me that flossing might be better than brushing, but not many people floss out there, to be honest with you. And so I try to push flossing on people, with, of course, brushing every day and going to the dentist. And then for the gut, I definitely recommend fruits, vegetables, healthy foods, yogurt, probiotics to keep the gut functioning as well as it can.
Okay, thank you. Different types of stress and the relationship on your health and your body. Can you speak to that a little bit?
For mental stress, or
just people define types of stress differently, so let's just say there's stress due to too much environmental stuff, whether it be work or finances or whatever.
I mean, stress, it definitely increases cortisol and other chemicals, that are detrimental to the body, can raise blood pressure. We know that being under stress, and especially if you have mood, depression, anxiety, can certainly lead to cancers as well. Probably affects like our blood pressure, heart disease, and that kind of thing. So reducing stress is very important, and I always start with, again, the natural approach, which to me, daily exercise and stretching, and then considering I like the infrared sauna. There are some studies on polar plunge baths now too, for people that those can increase chemicals in the brain that reduce stress. So I'm a very big proponent for those. There are some supplements out there that are supposed to reduce stress as well that people can research and read about. And then again, I'm not anti-medication. If someone has tried everything and they're still having stress, then increasing serotonin levels in the brain certainly can help reduce stress. And there are supplements and medications, prescription medications, that can increase serotonin levels in the brain to help keep the stress down. Of cortisol obviously drives stress, especially at night for people who aren't sleeping. So there are, again, supplements that can help regulate cortisol. But I always will have to go back to me, the best reliever of stress is exercise and a daily type stretching routine. And there's meditation, there's deep breathing exercises, there's what's called progressive muscle relaxation. So these are all things. There are apps now that are on our cell phones that can help guide people through these yoga. That's a great exercise to do, and that's similar to stretching that I believe can help reduce stress levels. So if you can't reduce the stress level as far as the environment goes, so if you can't switch your work, or lessen your workload or whatever, then you should pursue ways, whether they be natural or with supplements or prescriptions, to reduce your stress, because reducing the stress is definitely going to add years to you.
What's one thing, if you showed everybody for their well-being medically, what would you say to someone?
I just have to go back to life is short, and if we ignore our health, then if we, like I would say, bury our heads in the sand and don't think that things are going to happen to us, especially when you're bad at this, because I think that the statistic several years ago said that only, I think it's like 40 to 60% of men don't even go to the doctor ever. So, and that's just, it's bad. And that's another reason why I opened this clinic. So, I think you have to become proactive in your health, and you have to, value life and also, the longevity of our metal, not going to be here forever. And so, I also like the Nike mantra, just do it. So to me, you've got to force yourself to get up and participate in life every day, and get out and be active, and also be social, and try to eat healthy, get good sleep, and then go to the doctor, and then find a doctor that you're comfortable with, that you can talk to, that you feel like has your best health in mind, so those to me are the most important things that I can recommend to people, because again, you want to live for yourself, but you also want to live for others in the family. Men are bad, because, and that's a lot of what I'll tell them is, if you're not going to do it for yourself, do it for your wife and your children, because they certainly want you to be around.
Dr. Brooks, I want to thank you for joining us today and sharing your wisdom, your experiences. To anyone, do what serves you well and take care.
Thank you very much, Richard. I appreciate you having me.
Thank you.
Thank you.